All right, I believe we are live. Welcome to the Omega Revolution. My name is Debbie, and today we have a special guest by the name of Tammy Weiss. And before I introduce my guest, I just want to share a little bit of housekeeping with you. The information provided by the Omega Revolution is for educational purposes only. It's not intended to diagnose, prescribe, treat, or cure any disease. And it's the responsibility as a consumer of this content to learn about health issues that may be affecting you personally through further reading or consulting with professional medical help when needed. The Omega Revolution aims to provide all of its users with an abundance of knowledge that will help them live better lives in both mind and body. Building a healthy lifestyle takes dedication combined with education from trusted sources like our team here at the Omega Revolution. So this afternoon or this morning, wherever you are coming to us from, we have a special guest by the name of Tammy. And Tammy is a longtime friend of mine. I really hate to say how long we've actually known each other because it is 40 some plus years. And Tammy is BC born and bred, British Columbia, Canada. And Tammy has always had a passion for healthcare and for helping people, whether it be her family or people in her community. Tammy is a wife and mother of two, a boy and a girl, Brett and Kelsey. Tammy has also been a military wife for over 26 years and stationed across Canada and the USA. Tammy completed her nursing in 2009. Currently, Tammy lives on Vancouver Island and is a clinical nurse leader for a community care facility. Her specialties lie in foot care, wound care, and palliative care. And this is why we have Tammy here today, because we are talking this week about diabetes and management and prevention. And as a foot care nurse, I thought this would be an amazing topic to have Tammy, who is very knowledgeable on this topic, share some information with us. So Tammy, the main purposes of foot care, and correct me if I'm wrong as I quickly go through a short list. The purposes of foot care are to maintain mobility and function, prevent ulcers, prevent injury of the foot, promote early healing of the foot, prevent infection, and last but not least, possibly save the foot from amputation. What changes does a foot care nurse look for in the feet?
There's a lot of changes to look for. Also previous, being a foot care nurse, it helps prevent falls as well, which geriatrics, it's huge. So that's one of the things as well, to make sure that proper foot health will help that as well. One of the changes, some of the changes that we look at in feet, when I go in as a nurse, I'm doing the full assessment. Not just your feet, but the whole, because obviously we know it affects everything from, diet, environment, that kind of thing. So I'll look at the skin. Some of the things that I'm looking for, especially in a diabetic, thin, dry, dehydrated skin, I'm looking for skin breakdown. What's causing the skin breakdown, temperature, if it's cold, warm, inflamed. One of the things I do a mini assessment on their sensation as well. A lot of diabetics do not have any sensation in their feet. So that's a big one that I'm looking for as well.
So how would you test for the sensation? Is that like the pinprick or light touch? Like, can you describe that maybe a little bit, how you would do that at home?
We do both. So, we have, everybody's different. So there are people that don't have any feeling at all, and there are people that have just a decrease. So every time that I go in, whether it's 6 weeks, 4 weeks rotation, I do a little mini assessment, because each time that I'm doing it, it changes. So, 1 month, 6 months down the road, they might lose sensation. So depending on what their sugars are like too, you kind of watch for a little bit of everything. With a diabetic foot, you got to really be careful on their nail growth. There are so many different types of deformities. nail growth. I have to look for it all because that contributes to wounds.
Right. So that brings us to some of the complications in wounds. And I'm just going to share a picture here that I found that shows a type of wound. Oh, hang on here. I'm sharing the wrong one. Here we go. So this would be an ulcer, correct? And is this something that you see on a regular basis, or is this something that is like way out there and you don't normally see?
Actually, the picture of the 4-week, I see a lot of ulcers forming underneath. So that's why foot care is so important for any diabetic, even somebody that's not diabetic. There's a lot of people out there actually are undiagnosed. It starts with that tiny little pinprick right underneath the skin that when I'm doing the foot assessment that I will see. You have to really get on it very quickly, setting up treatment plans, sending them to other healthcare professionals to avoid any kind of amputation or any wound that could be potentially very dangerous.
Right.
So I see it actually more often than I'd like.
Right. Okay. So what types of tips does a foot care nurse recommend to avoid these skin complications?
There's a lot of different tips that I can give anybody that, well, whether they're diabetic or not. Make sure that your feet are washed with mild soap, dried well, especially in between the toes, checking for any open areas. Make sure the skin gets dehydrated. Make sure you have your feet are moisturized on a daily basis, especially if you have decreased sensation. Take a look at your feet every day. It's nothing to glance down to take a look. Making sure that you're wearing appropriate socks, appropriate shoes. Footwear has to be, a lighter, wider toe box, so you're not squishing or causing any inflammation or anything like that.
So some of these here that I've just put up on the screen would be some very good tips for those at home that, maybe are pre-diabetic or, are just concerned or they're elderly. And because this is going to relate not to just people that necessarily are diabetic, but just overall health as we get elderly, correct?
Absolutely. And there are everybody's different. So I do treatment plans that it's going to work for community-based, depending on how old they are, their mobility. I have to set something up that I know that they're going to follow through and that's going to work for them.
That's quite, that can probably be quite different. Your job would not be easy, especially for those that are struggling to admit to themselves that they need your help.
Well, being in the community is the best thing because, preventative, that's why I'm there to help them. And if I can teach them, maintain as much as I can, that's what I do. Okay. And it's always changing, which is great.
Right. Absolutely. Every day is a little bit different. What about structural assessment? Watching the arches of the feet or gait changes. Do you notice, or can you talk to anything that you see that you watch for in that regards?
Absolutely. So when I do the foot assessment, I also look at what footwear they're wearing. I'll kind of assess a bit on their equipment, what they're using. Even good foot care can change a bit of their gait when they're walking, and it actually does make a difference. But there are times where somebody might have a fallen arch or a very high arch. Offloading is huge. So I have treatment plans.
I'm going to interrupt you for a second. You speak in terms that I'm not familiar with. So can you explain what offloading is? Because I'm not familiar with that term.
I can give you an example. If somebody has an extremely high arch, and I'll say it, their greatest toe, the big one, where you have that area just on the bottom of your foot, and I'll take my hand, it's right about there. Those are common areas for sores.
Okay.
So offloading, there's different ways that I would make sure that there's cushion there to make sure they're offloaded. If I have to refer out to orthotics, a podiatrist, that's what we do. But we make sure that we cover every angle that we can to help that person.
Wow. Yeah, you definitely have your work cut out for you, for sure. What happens to the feet when the blood glucose levels are too high?
There's decreased sensation is one of them. You know, everybody is different, but you know, when their sugars are really, really high, there are so many things that I notice. I've noticed, you know, swelling, redness, and wounds that won't heal. That's the biggest things. When the sugars are really high, wounds don't heal.
Right. So when you know, a lot of people aren't really sure, or, you know, they're not familiar with what wound care is. And this is just it. It's a wound that does not heal. And it takes extra special care. And I know, even, for example, when my dad had open heart surgery and they took the artery out of his leg, his whole leg healed, but down by his ankle, that would not heal. And I think it was probably a good year, almost 2 years, before he was able to get into wound care, and that was able to close up and heal. So, you know, everybody is going to be a little bit different, but so you see that a lot then with the feet.
Well, yeah, there's no blood flow. A lot of people don't have that proper blood perfusion down there, so it's harder to heal when it's not flowing. And another thing, I would make a recommendation, especially if that happens, if they're swollen. And if you could even see some of those tiny, tiny little wounds that you think, oh, it's nothing, especially on a diabetic, you get on it. Compression stockings are great because, oh yeah, they're fantastic. I even wear them for running. They're great. A lot of times I will recommend that, unless of course there's a wound and it's very difficult to put them on. I mean, it varies from each person, but even those tiny wounds that people have at the end of their toes, it takes a long time to heal them. And that's when you want to get on them, you know, get into a foot care nurse, a nurse in general, to set up something quickly, keep it clean, keep it dry, make sure that, you know, there's no pressure on it, that kind of thing.
Okay. So is it hard to get a foot care nurse? Like, what would be the procedure if I was thinking that I might have an issue? Like, do I, you know, and like right now it's hard to get into a doctor possibly, or everything's virtual. How would you recommend, if I was concerned about my feet, what would you say my first steps should be?
If you're concerned about your feet, you would want to definitely get a foot care nurse in your area. It is a specialty training, and I'm not quite sure what it's like in the interior to get foot care nurses. There's not a lot here on the island. There's a few of us that partner up and try and help as many people as we can. But it is difficult to find them. They are there, and you know, sometimes you might have to wait a little bit. But those foot care nurses not only are going to take care of your foot health, but they're going to watch for any wounds and report when necessary.
Okay. I guess maybe what I should have told you is that we're just not being live here in BC. We actually have people from all over the world.
Okay.
So maybe it was a good thing I didn't tell you that, because you've been doing amazing, and I thank you for sharing with us so openly, you know, something that you've been passionate about for many years. So in closing, I have a quick little checklist that I think might be important, but you answer and let me know if if it's true. So number one, check your feet daily for injuries.
Yes.
Okay. Wash your feet carefully each day. Moisturize. I remember you talking about those. Moisturize your feet, ankles, and legs daily, but do not use between the toes.
Don't put any lotion between your toes, but make sure they're nice and dry between.
Okay. So cut your toenails straight across to prevent ingrown toenails.
Nope. Follow the contour of the toenail.
Okay.
Yeah, there's some tricks. Yeah.
Okay. So if I was, a little bit concerned and I couldn't get a foot care nurse right away, maybe I should go for a monthly pedicure. No.
I would prefer to see a foot care nurse. Just with the infectious disease out there, I would want to make sure that everything was autoclaved and cleaned appropriately. Absolutely. And that is really a huge thing for me, to make sure that everything's sterile through the autoclave. It's scrubbed accordingly, following all IP&C. Yes.
Okay. Keep your feet warm and dry.
Yes. When
cold, wear loose fitting stockings to bed.
Yes.
Okay. Wear comfortable closed toe shoes, which you covered.
Yeah. Wider toe box is always helpful.
Okay, what about this one? Never walk barefoot, even indoors. Have you heard that one?
Oh, yes.
And well, tell me why, because I'm barefoot every day and I love it.
Oh, I know you are. Especially for the elderly, I have them wear non-skid socks, just because they're a fall risk, and it keeps their feet warm and dry, and less for them to get some kind of infections. It's just a little bit more of a barrier for them. I would prefer them wearing, and a lot of them do have indoor footwear, which is much better for them.
Okay, cool. Do not smoke. I think that's becoming more, right?
No smoking.
9 years. Ask your podiatrist about orthotics or insole options.
Yes.
Okay. Ingrown toenails, corns, or calluses, seek the advice of a podiatrist or your foot care nurse.
Absolutely, yes.
And always, as we said at the beginning, discuss your condition with your primary care physician or your community health care nurse who can help you. Is there anything else that I'm missing or that you would like to share with the Omega Revolution and we're actually live. I was just checking to see if we had any questions from the audience, and we don't at the moment, but we do also have 2 people on here, and if they have any questions, they're more than welcome to ask them. And if not, I will get you to share any last minute comments that you think I may have missed or what we should really be watching for.
All in all, eating healthy, a healthy diet is the biggest thing. Exercise, whether it's a walk around the block, and if you're elderly or not even elderly, depending if you have to use a walker or anything, go for a walk around the block. You're getting that blood flowing. So, exercise, diet, enough sleep, the normal that we all know and ignore.
Yeah, we do. And that and getting out and walking, that's part of it. My husband, he actually went and bought me a standing desk because I was sitting too much. And as we know, sitting is the new sedentary disease that's coming out there because we spend so many hours sitting behind our desks. And so yeah, definitely we need to get out and get moving.
Yeah, I'm fortunate, community nursing, I'm in and out and up a lot of stairs.
You're always on the run. I know that. You're so hard to track down, and I appreciate you taking the time today to spend with us, and I'm hoping you will come back again real soon.
All right. Thank you. Have a good day.
Okay. Oh, hang on. Just before we close out, we do have a question in the chat. Oh, it was a thank you, but I just wanted to because we are actually doing a, that's the whole point of this, is that we're having a presentation on tomorrow night. And the presentation, it's not opening here for me. I don't know why. The presentation is actually on diabetes, and it is being presented by Dr. Sharon Selman. And it starts at 7 p.m. Pacific Daylight Time, 8 p.m. Mountain Standard Time, and 10 p.m. Eastern Time. We are also having the same event broadcast at 6 p.m. Pacific Daylight Time in Spanish. So we're looking forward to bringing Dr. Sharon Selman to all of you tomorrow, talking about diabetes management and prevention. So thank you again, Tammy, and we'll touch base again real soon. Take care, everybody.
Bye. Thank you.